Hi, I'm Piper Harris, a speech pathologist with Midwest Dysphagia Consultants. In the next few minutes, you will learn about Midwest Dysphagia Consultants, your leader in mobile modified barium swallow studies. No more lengthy transportation for your residents to and from the hospital for this 15-minute procedure. No more waiting on fax reports, and no more scheduling headaches, especially for our patients with dementia. Midwest Dysphagia Consultants comes directly to the door of your facility and has your resident in and out in 15 minutes with a DVD and a full report and recommendation for the safest diet to try to keep residents from getting pneumonia from food or liquids entering the lungs. So sit back and relax while we educate you on the importance of early detection of swallowing difficulties to try and keep residents from getting pneumonia from unsafe eating and drinking patterns which can be life-threatening. The mission of Midwest Dysphagia Consultants is to provide quality patient care in order to alleviate pain and suffering and help patients achieve a better quality of life. In doing so, the organization fosters a perspective in public health that recognizes the needs of the patient as the most important element of daily operations. Midwest Dysphagia Consultants is grateful to take the resources at hand and help another individual and to give comfort to family or friends regarding their loved ones, regardless of their payer source or station in life. Midwest Dysphagia Consultants arrives at your facility, brings the patient out, and in 15 or 20 minutes assesses the functional swallow of the patient. If there are difficulties and the patient is having trouble swallowing, the speech pathologist may try positional strategies or thickening liquids to keep food and liquid out of the airway, preventing the patient from getting pneumonia. Now you will see a normal swallow which quickly becomes abnormal. Initially, the patient's swallow appears functional. As you will see, the dark consistency, representing food or liquid coated with barium, enters the esophagus, which is down the back portion of the throat, with none of the black liquid or food consistencies moving forward into the vestibule or airway. As the patient continues to swallow, this swallow quickly becomes abnormal, with liquid or food entering the airway. The facility receives a full report for results and recommendations within minutes. So how do you know if your patient needs a swallowing study? You may notice when feeding patients that they are coughing or choking at meals, have watery eyes or a runny nose, have increased congestion, temperature spikes, complaint of difficulty swallowing, loss of appetite or significant weight loss, holding food in the mouth, pain when swallowing, recurrent pneumonia, refusal of particular foods or all foods, altered diet with no documentation, a PEG placement with no assessment of the swallowing function. Overall improvement should be assessed as well for diet upgrades, even NPO patients who may be requesting food. Two important questions to know the answer to is why give patients thickened liquids? And what's the difference between thin, nectar, and honey thickened liquids? The thicker a liquid is, the slower it moves, giving patients time to close off their airway before they swallow. Nectar liquids move slower than thin liquids, and honey liquids move slower than nectar liquids. Giving thickened liquids can equal a safer swallow for most of our patients, and having a safer swallow means the prevention of aspiration pneumonia, which can be life-threatening. Once you've identified a possible swallowing problem with one of your patients, notify your director of nurses or speech pathologist for this form to schedule a modified barium swallow study with Midwest Dysphagia Consultants. Fax this over with the face sheet, and our goal is to see you in 24 to 48 hours. Thank you for choosing Midwest Dysphagia Consultants as your mobile modified barium swallow study providers.